Parents need to bring their important documentations as far as their insurance card or medical coupons or a list of medications.
The other one is bring something that is comforting to the child that's having the surgery. That may be a blanket, that may be a favorite toy, that may be something that smells or reminds them of their parents. And we bring that into the operating room, and that item follows the child through their whole hospital course. As a team, we're always concerned that the family has fears or worries that we're not recognizing, and that's why they meet with more than just a surgeon.
The anesthesiologist, hey, your mom and dad?
So they'll meet with our social workers, with our pediatricians, with our nurses, in some cases with our child life specialists, to be able to really have a chance to vocalize what they're afraid of, what they're worried about, so that we can give them the information to feel comfortable to go ahead with the surgery.
And do you want his blanket to go with him?
Yes.
Okay, this is the blue one.
Things that families are often worried about is that you're touching an area that's close to a baby's brain, and that can be incredibly frightening for a family that they're bringing their baby to our team.
All right, Mom, give me one more little kiss here, okay?
The reason that we do see this as a routine surgery, even though it's a big surgery and even though there are potential risks, it's a routine surgery for us is because we have one of the largest volumes in the country. We do this on a weekly basis. There's 4 dedicated surgeons that do this surgery, and they're all incredibly experienced and used to working together. But we don't put needles in young children. There's different ways you can put a child to sleep. Typically it's by gas, so there's a little mask, like a little astronaut mask, that you can make different flavors. Make it smell like root beer, you can make it smell like strawberry, and that mask goes on the child to make them just gently go to sleep as they're breathing, and only when they're asleep do things like intravenous's go in. Blood loss.
Surgical brief?
Endoscopic strip craniectomy. We have all our equipment, anticipating around an hour to an hour and a half surgery once we get started. When a surgeon's in the operating room, they're almost like in a focused Zen state. All they're focusing on is the surgery and the child, and that's the safest way for a surgeon to be able to work. The only way a surgeon can do that is if they know that a family, the rest of the child's needs are being taken care of. So the family is going to be waiting. They often have the hardest job. The child is asleep, they're not feeling anything, they're having a good snooze, whereas the family is sitting there thinking, worrying, wondering what's going on.
The Surgery Center is very good at giving parents updates to help let them know how their child is doing while they are waiting.
So we have a nurse in the room who has introduced themselves to the family, and that nurse will call the family roughly every 2 hours during the surgery, giving them updates, letting them know the progress of the procedure, and roughly when the surgeons will be finished so that they can come out and talk with the surgeon in person. And we also let them know that if they need to know anything, they will know straight away. They all carry pagers. We will page them instantly if there's anything that they need to know about.
They are part of their child's care, and that they can ask questions at any time. That it is a stressful time in their life when their child is having surgery and being in the hospital, and that the craniofacial team providers will help guide them along the way.
We are here to be able to help children with craniosynostosis. We do this surgery more than anyone else. We have a wonderful, large, integrated team and hospital to be able to care for a child with craniosynostosis. And so we're here for the child and for the family to make this as least scary as possible, as comfortable as possible, understanding their worries and their concerns, but making sure we can get them back to their lives as quickly as possible.